Y'all, everybody is still talking about weight loss medications right now. And I feel like this is a conversation that's going to continue and continue and continue to evolve. But what I'm noticing is that everybody is focusing on our Ozempics, Wegovys, Mounjaros, Zepbound, all those GLP-1 medications. In addition to that, the other problem is that a lot of people who are taking or considering taking these medications are doing so without fully understanding what they actually do inside the body. And when you don't understand that, you don't know what to expect from these meds, you don't know what to watch out for, and you really don't even know if it's the right option for you. And I've heard a lot of people who are kind of on the cusp of like, do I ride this wave and try something for my weight loss? Because maybe it's hormonal and you're doing all the things you need to do from a dietary and physical activity standpoint, and it's still not working, but you're someone who's skeptical about starting medications or feel some type of way about starting a medication. In this video, I'm going to break down the major weight loss medications. We're going to talk about what they actually do in your body as well as their side effects. Who are they for? And then some of the things that I don't think get talked about enough about these medications. And hopefully that helps you make a little bit of a better decision about whether or not you want to start one for yourself for a short period of time or even for an extended period of time. If you are new to my channel, my name is Takova. I'm a board-certified primary care pharmacist and an academician in the medical education space. And on this channel, I break down medications in a way that will actually make sense so that you can make informed decisions about your health. This video is for education purposes only, just like all the other videos on my channel. It is not medical advice. I always want you to talk to your provider before you start anything, over-the-counter, prescription, before you stop anything, or before you start changing up any of your medications. So use this as information to take forward to help enhance the conversations that you have with your providers. Now, before we jump into specific medications, I really want you to understand this. Weight loss medications are generally going to work in a few key ways. They are either going to reduce the appetite, reduce your cravings, change the way that your body actually processes or absorbs food, or they can affect your metabolism and your blood sugar. And there are a few different pathways within that these medications can target, and some of them target multiple pathways. So when we talk about people being on weight loss medications, it's really a whole category of very different mechanisms that could fall into that. All right, so let's get into it. First, we're going to talk about the GLP-1 medications because, again, these are very widely talked about right now. Some examples of these are things like Ozempic and Wegovy, which are semaglutide. We also have Mounjaro and Zepbound, which are tirzepatide, and then there are some others that fall into that category as well. As I mentioned these brand names, I also think it's important to note that some of the brand names are, like Mounjaro, have an indication for diabetes, whereas its cousin, Zepbound, has an indication for weight loss. And so you have to make sure that you are getting the right medication for your indication, or your insurance company is not going to pay for it. So that's just a side note. But let's talk about how these medications work. So these drugs mimic natural hormones in your body. One of those hormones is called GLP-1. The other one is called GIP. So tirzepatide, which is Mounjaro and Zepbound, has both GLP-1 and GIP in it. The other medications only have GLP-1 in it. And so after we eat, our bodies release GLP-1 and GIP. And these hormones tell our body a few key, very important things. It tells your brain that you're full. It tells your stomach and kind of your brain too to slow digestion. It tells your pancreas to release insulin when you need it because of the food. And it also tells your liver to slow down on producing more glucose or more sugar because we don't need it at this moment. So because it tells our bodies those very key things, when we take these medications, the food is going to stay in our stomach longer, which is going to mean for you that you'll feel fuller longer, your appetite will decrease, and if it's needed, your blood sugar will be better controlled. Over time, the combination of all these benefits is going to lead to weight loss. However, we also know that it's going to lead to some side effects. So nausea is the most common one, especially early in treatment. Some people will have constipation, other people will have diarrhea. That one just kind of depends on the person. Decreased appetite, we expect this, but sometimes it can be too much. If your appetite is so decreased that you're not getting nutrients, that you're not eating anything at all, make sure that you're supplementing, first of all, but also try different approaches like smaller, more frequent meals. This is definitely something that you can work with like a dietitian about to figure out what's going to be the best avenue for you to make sure that you are actually getting the nutrients that you need. Now, some less common but also important things to mention as far as side effects with these medications is that they can potentially lead to gallbladder issues and also a rare risk of pancreatitis. So if you've already got gallbladder issues or a history of pancreatitis, then we probably would not want to start you on one of these medications just because we don't want to make that worse. And then thinking about people who we probably would not have you take this, or definitely would not have you take this. If you have a history of medullary thyroid cancer, it's going to be a no-go. There are some endocrinology-based conditions, especially dealing with the pancreas, where we'd be a lot more cautious or decide not to put you on this medication. And then people who just can't tolerate the GI side effects. There are some individuals who already have slowed gut motility or slowed movement of food through their gut for one reason or another. And so if you're that person, then putting this medication on top of that would further slow absorption and increase your discomfort and things like that. And so we might be very cautious or decide not to put you on this medication at baseline. Now, some pharmacy pearls to consider with the GLP-1s is that we're always going to start low and go slow. This is really going to help reduce the nausea that we see with these medications. And so your provider will give you 1 month of the lowest dose, and then after that, bump you up to the next dose for at least a month and see how that goes. And then potentially, if there's a dose escalation from that, bump you up again. Now, if you are sick on that bumped up dose, you can always go back down. You're still going to see benefits with it. You may not see the same benefits as we saw in the studies, but you'll still see benefit. And for some people, they get enough from the lower dose. They don't need to lose as much weight as some of the studies saw. Also, hydration matters a lot more than people realize. So make sure that you're drinking enough water. And that's very subjective, right? Because I've heard people say they drink 2 bottles of water today, and that's a lot for them. You got to keep yourself hydrated. Our bodies are 80% water. And so keeping that in mind, give it back to your body. Give it back, give it back, give it back. So hydrate. I drink at least a half a gallon to a gallon of water every day. I drink a lot of water. Hydration matters. And then if you're not eating enough protein, you can lose muscle. So keep in mind that these are not fat loss medications. These are weight loss medications. And so you are losing weight from both muscle and fat. But you need to do something to maintain that muscle because that muscle has so many other benefits for our bodies. It's such a huge metabolic driver. And so that either means eating enough protein and also getting enough strength training in to help maintain that muscle. All right, that's enough on the GLP-1s. Let's talk about a couple of combination products. The first one I'll talk about is called Qsymia. Qsymia is a combination of phentermine and topiramate. And before I go into this one, I do want to say that phentermine can be used alone and is still very commonly used alone, but it also comes in a combination product. So I'll talk about it in the context of the combination product, but everything about phentermine being used alone still stands, and it works well that way for a lot of people. So the combination product works by first having the phentermine in there, which is a stimulant. And so as a stimulant, it increases a chemical in your brain known as norepinephrine. And then norepinephrine goes on to do its role in suppressing appetite. So phentermine is a stimulant that essentially suppresses your appetite. And then we've got topiramate, which is actually originally and still used for migraines and seizures. But we also discovered that the medication is good for reducing appetite, helping with cravings, and also changing how rewarding food can feel. And so when you put these two together, they're going to target both hunger as well as cravings. Of course, we're going to have side effects like with any medication. Because we're dealing with a stimulant, with phentermine, increased heart rate. Some people have trouble falling asleep just because they're kind of revved up, potentially dry mouth, and some constipation and things like that may come along with it. Now, because of the topiramate component of it, some people complain of tingling in the hands and feet, and also a brain fogginess that you might get from being on topiramate. So if you notice any of those things early, talk about it with your provider and continue to talk about it as long as you're on the therapy. If you are someone who has uncontrolled high blood pressure or certain heart disease conditions, we're not going to give you this medication. And also, if you're pregnant, we're not going to give it to you because topiramate is a teratogenic. So either if you're pregnant or if you are not pregnant, but you're of childbearing age and you're not on birth control, we're not going to give you topiramate, okay? It's not going to go down that line. Now, some pearls to think about with this combination product is that it is really important to think about your sleep pattern because it can affect your sleep and keep you up. Make sure that you're just taking it earlier in the day. Some people like to take medications at night, and with some medications that is fine, but with a stimulant, it's probably not the best idea. And then also make sure that you're monitoring your heart rate and your blood pressure. Phentermine component in this, you want to make sure that you're checking that a few times a week. So that means you got to check it at home. Don't just wait until you go to your doctor's appointment to check it. Keep track of it yourself and make sure that you are not getting too high when it comes to your blood pressure or your heart rate as you stay on this medication for a period of time. Now, the second combination product is a branded product called Contrave. And Contrave has Bupropion and naltrexone in it. Now, this one also works a little bit different because here, I think it works well for people who need more of a behavior change and we're trying to address cravings that might be coming up. And so Bupropion specifically has been used or is still used for depression as well as for smoking cessation, but it affects two chemicals in the brain, both dopamine and norepinephrine. And so because of that, we are really working on this behavior component of it. And also, just like with the Phentermine, it's going to help suppress your appetite because we are helping to increase the amount of norepinephrine that's available. Then we have naltrexone in this, and naltrexone blocks opioid receptors. It's an opioid receptor blocker. And so because of this, it helps reduce some reward-driven behaviors. We're just getting rid of if food would cause chemicals that bind to that receptor to make you feel this reward from it, then we're kind of blocking that. Together, these medications work on cravings as well as emotional eating and the reward pathway in the brain. But we may see some nausea, some headache, some insomnia with this one as well. Now, if you're someone who has a history of seizures or uncontrolled hypertension, we're not going to give you this medication. And also, if you're someone who is taking opioids for chronic pain, or even if you have an acute pain and you need to take opioids, people need to know if you're on this medication because naltrexone is going to block them. Naltrexone is an opioid receptor blocker. So we don't want to block those receptors that your opioid is supposed to be binding to help with your pain. Medication as a combination product can be especially helpful if you are someone who is more of an emotional eater or if your eating is driven by craving, keeping in mind that sometimes hunger is more about behavior than actual hunger, right? So we want to try to address that behavior, whether it's, again, the emotion or the cravings or whatever it may be for you. The last medication I'll talk about is called Orlistat, and this one works completely different. So Orlistat blocks an enzyme called lipase in your gut. Now, this enzyme or this chemical lipase is responsible for breaking down fat. And so it breaks down fat, and that way our bodies can actually absorb it. So if you block it, then the fat that you eat or some of the fat that you eat is not being absorbed. It's just passing through your body instead. That means that you're going to have more fats in your stools. So a side effect of this medication is oily stools. We also get people complaining about GI discomfort, so just pure discomfort in the gut. And then I always tell people, if you're going to take Orlistat, hopefully you don't have anywhere to be because you're going to have urgency going to the bathroom, especially if you've eaten a high-fat meal. You're going to need to go, and you're going to need to go as soon as you feel that you need to go. It is a little bit inconvenient for that reason. Now, who should avoid it? If you have certain GI conditions or stomach conditions, you may not be a good candidate for this just because we are affecting absorption of certain vitamins and things that you may already be having an issue absorbing. And then also people that just can't tolerate the side effects. Some pearls to consider with this medication is that, again, it will teach you very quickly how much fat you have in your diet because you'll see the oily stools and how much oil is coming out in your bowel movements. And so hopefully that will help you modify your diet in that way. And then also you may need to supplement with fat-soluble vitamins because we are preventing the absorption of fat. We're also preventing the absorption of certain vitamins that depend on that fat. And those are vitamins A, D, E, and K. So you need to supplement with some product in order to make sure that you're getting enough of those vitamins. Now, the last medication I'll talk about, again, is not like considered a weight loss medication, but you may see some weight loss with it. And a lot of people are on it. So I want to mention it just for completeness sake. And these are our SGLT2 inhibitors, things like empagliflozin or dapagliflozin, which are medications that are used for diabetes and heart failure. And specifically, they work by blocking sugar reabsorption in the kidney. So normally, our blood gets filtered through our kidneys, allow us to excrete or pee out what we don't need and reabsorb back into the bloodstream what we do need. And so they filter everything and give us back what we need. So normally we reabsorb a lot of glucose from the kidneys. And if your blood glucose levels are really high, then you're still going to reabsorb a lot of glucose. So what these medications do is they block that reabsorption from happening. And so we pee out a lot of that sugar. So you'll see more of it released into your urine. So what this means in terms of weight loss is that you're losing calories through glucose. And you're most optimally going to see the weight loss benefits with this, of course, if your blood glucose levels are really high. That's something to keep in mind as well. If you're someone who does have a history of type 2 diabetes, then it can be beneficial for that way. And you may see some modest weight loss with it because as that glucose goes out, then we also get fluid going out. We see some sodium going out as well. And so because of those things, not only do we see the weight loss, but we also see a little bit of benefit for your blood pressure as well. Some side effects of this medication: increased urination. You're going to pee a lot more. Also, increased risk of genital infections, yeast infections, just because there is a lot of sugar in the urinary tract and bacteria and fungi thrive on sugar. And make sure that you're drinking, again, plenty of water and be extra hygienic if you're on this medication. And then a couple of pearls about our SGLT2 drugs is that they are often, again, used for heart and kidney protection. We are happy that we see a little bit of weight loss benefit with them, but the main benefit of these drugs is heart protection and kidney protection. All right, so I wanted y'all to stay because I do want to say that none of these medications are going to work in isolation. Even our most effective weight loss medications are going to work best if they are combined with things like nutrition support, movement that you can actually sustain and continue to do, and habits that you can maintain in the long term. And the goal here is not to do something that's super extreme. It's just to do something that you can sustain and think about the fact that medications are really meant to be tools for us to utilize, a tool from our toolbox, but not something that's going to replace what we need to do, which is diet and physical activity. And the truth of the matter is we know that there are so many things that contribute to weight gain, as well as the hardships with weight loss. And so I think it's really beneficial and great to be able to have a medication that helps you while you're trying to maybe stabilize hormones, or maybe you're on another medication that is causing weight gain. And like right now, you can't get off that medication. There's so many reasons why people struggle with weight. And so you make the decision that feels great for you. But even if that decision is to start a medication, just know how it works. Know what its benefits are, what its risks are, whether this is going to be something that you're thinking about short-term or long-term. Have those conversations with your provider. And also think about how you compare this with whatever lifestyle factors are best for your situation. And again, that could be hormone balancing, that could be nutrition guidance, that could be physical activity guidance, but do what works for you. Now, hopefully this video was helpful. If so, please share it, like it, and let me know in the comments, what are some of your thoughts about weight loss medications, or have you been on any of these weight loss medications? And I'll see you in the next one.